Hello and welcome along to this Staying Active and Able in Later Life presentation. My name is Stephen Gammack. I work for Western Sydney Local Health District as a Health Promotion Officer. Specifically, I work with older adults, so promoting the benefits of being physically active and making good health choices for optimal well-being. So this presentation is about how to stay fit and strong and independent as you get older. So we're just going to go through a few range of slides to look at some different things you can do to maintain your health and well-being in later life. Okay, so we'll start off. Our aim here today, basically our aim in our role working in Western Sydney population health, is to encourage people to stay well and independent. So really want to help people get the most out of their retirement years. So really looking at the way that people age and choices that are healthy to make sure that those later years are ones that can be enjoyed to the most. So if we start off, we can look at obviously something like hospitalization. So why do people generally go to hospital? What is the reason as we get older that we're most likely to end up in hospital? There can be a range of different things. Obviously, we ideally want to be healthy and probably want to avoid being in hospital. I don't think anyone enjoys going to spend time at hospital. But we want to look at what the reasons are why this does happen. And one of the main kind of points we want to get across today is that actually your risk of falling is one of the highest risk factors for hospitalization. One of the biggest causes of issues as we get older is actually falling, which is something that we can actually do quite a lot about. If we look at some of the risk factors for falling, you've got the previous history of having a fall. So if you've fallen once, you're far more likely to do so again. And again, this is something we can address. We can also address foot problems and unsafe footwear. We can look at the food we eat, so inadequate nutrition, so the type of food that we're eating and the quantities. And then we've also got chronic conditions which are reducing our physical activity. So we can also look at how we can make sure we still implement physical activity into routine. And a strong focus of this presentation will be on the benefits of being physically active. So we will look at that. We can also look at, eyesight and vision, what simple things we can do with that, as well as medication, and then hazards around the home, and then hazards when we're out and about. So quite practical things that we can look at. But one of the main messages we want to get across is as we grow older, we do lose muscle strength and sense of balance, and this can lead to a fall. So it's really, really important that we do take steps to maintain our health and well-being. And also the big message is that although we lose strength as we get older, we can actually gain strength at any time in life as well. So if you are starting from a low point where you've not been doing much, then you'll find you'll have the biggest gains by starting to be physically active. So it's the really biggest influence we can have on staying fit and independent as we get older, because we all want to be able to stay independent, do as much as we can for ourselves and possibly for others as well. That's going to be important too, whether it's partners or spending time with family and friends. So a big thing then from that is to look at physical activity. So physical activity is a really important factor in staying healthy as we get older. So we can sort of define this as any bodily movement that uses up energy. And that's important because it doesn't need to be just the planned activities. So those examples where it's a sport or yoga or joining groups or classes. But it's also that incidental exercise. So we call that the unplanned things you do in your day where you're active. So that might be the household chores, could be gardening, again, just getting to and from places as well. And another important one as we get older is wanting to be able to play with the grandchildren and maybe dancing around with them or just having fun going to the park. All these type of things are really important. So we want to really get that message that it doesn't always have to be that you've set aside time to do something specific, but just in your daily life by being active around the home or going out and about with others or yourself, it can give you that exercise that you need for daily life. which kind of brings us on to the next question, which is around how much physical activity do we need to do. So if we look at how much physical activity we need to do, the main message to start off with is that we want to be active in as many ways as possible. So we can look at aiming for 30 minutes of moderate intensity physical activity on most, if not all days. So what does moderate intensity physical activity mean? Well, a good one to think about, and it's quite an easy one to follow, is call it the talk test. So you would be doing physical activity and getting yourself with your heart rate raised, a little bit puffed, but you could still talk. So you could still hold a conversation. If you get to the point where you're breathless, then you could probably want to be thinking about slowing down and giving yourself a little bit of a slower pace. So that talk test is quite an easy way of determining. You want to be at the point where you have got your heart rate raised, but not to the point where you're so breathless you couldn't speak. Then another guide on that is called would be sort of the singing test. So you want to be able to talk, but if you could start to sing a song, then you probably could work a little bit harder. It's a quite nice, simple way to look at what level you work to. So it's sort of that moderate intensity, get a bit warmer, get the heart rate raised, get the blood flowing around the body. But important, especially when you're starting out, is to start at a level that's manageable for you. So we don't need to think about the no pain, no gain or anything silly like that. It's basically just about getting that recommended 30 minutes of movement of the body and gradually increase the amount you can do over time. So consistency is far more important than doing a lot in one go. And on that point, we can think about doing those 30 minutes in 10-minute chunks as well. So it doesn't have to be all in one go either, which again, if you're doing some quite, reasonable intensity housework or gardening, that can contribute to it. But again, we want to make sure that we're looking after the body in anything we do. The variety is also important. So a range of different physical activities is going to keep people interested and motivated. Again, also doing things with other people can make a big difference too. So as many different ways as possible is definitely a good guide for how you go with exercise. The benefits of physical activity, and there's too many to really list on the one page, but here's just a kind of outline of some kind of key ones. It can obviously help with managing our weight, and then people can often have high blood pressure or low blood pressure, particularly good with managing high blood pressure, cholesterol, diabetes as well, really good for that, and also joints, so gentle movement that gets the body going for something like arthritis. Swimming would be a good one for that, for those who have access to a pool and feel confident for it. But really any gentle movement is going to be good. It's also going to improve energy levels. So often by doing something that uses energy, we actually do feel more energized because we feel less sluggish. And that kind of adds into the sleep as well. If we've had exercise, we often find we sleep better because it's just regulated a lot of the body parts that we use through being physically active by getting that blood flowing. Stress and anxiety and depression, a particularly important one at this time. If people have found they've not been able to get out and about as much, find themselves more housebound, then just doing a bit of movement and activity is going to help with that. And then reducing your risk of heart disease and stroke. So as well as bone and muscle strength, and I think both two really key ones. And just being on our feet can improve our bone and muscle strength, as well as our posture and balance, just by that being standing. So a key part of it is to not be sitting for long periods of time. So we want to make sure that we're moving our body, just so we feel good in the body. Because if we're sitting or we're slouched in a chair, it's going to affect our mood and how we feel as well. And then I really like the quote here, we don't stop playing because we grow old, we grow old because we stop playing. So just a little message there to just really think about, have fun, be playful, especially if you're with kids as well, but also with adults and with yourself. Make things fun, make it light, and see how that feels. You're kind of your perception of how old and how you age has a big impact on the process as well. So we want to think about that. Okay, so we've talked about incidental exercise, but if we are going to do some exercises, we do want to try and challenge our balance and increase our strength. And sometimes structured exercises can be good for that. Now, at the moment, that's obviously not going to be as easy, but we will in this presentation show you some specific home exercises that you can do to make sure you stay active. And then as things start to open up and you can get out and about, you can consider classes, and we'll have a few of them to share with you as well. Some of which will be online, so, giving that option for staying at home, and particularly if you feel it's safer to do so and following, those guidelines just now. Physical activity to improve balance. So balance is a really important aspect as we get older, and something that a lot of people do worry about. So I put the question in here, what about walking? So walking is very good for our general health and well-being, for our bones, our muscle strength and tone and mass. But we do need to do more than just that to improve and maintain balance. If we think about the movements we did when we were younger, they often involve dodging and moving in different ways, challenging our balance. As we get older and we maybe stop playing sports, we tend to do less sideways movement. And this is often where we can improve balance, is through that, what we call lateral movement. So moving in the sideways directions, or not straight forward and back, not that linear straight forward and back. So balance is an important thing to practice as we get older, along with strength exercises as well. And the recommendation for that is around about 2 to 3 times per week. So if you did that and you supplement that with your walking, it's going to give you a very good foundation of physical wellness. So let's look a little bit more at the kind of areas we want to strengthen in the body. So getting into a little bit more of the practical now. So it's just examples. They wouldn't be the ones you would have to do. And we do have some information that we can send people if you're interested. There'll be details at the end of our contact. So the knees and thighs, obviously the strength, and we want to maintain the strength in our thighs and on the back of the thighs as well, so that hamstring area, so that we're strong and supported around the knees as well. So those knee areas, an area often people find to get difficulties with. And it's really important when we do these kind of exercises that we do them with the correct form. So we're doing them to make sure we support the body and we're not going to cause any damage to the body. Also the hips and trunk. So the hip extension example here. If you think about that movement of the foot and that leg behind the body, it's very similar to the way you would move in walking, where you step forward and you extend the hip behind. So you want to practice those functional everyday movements in exercise like this. And then the side leg raise. Now we don't need to go through them all, but just to see that lateral movement, so that's that sideways movement. Very good for increasing strength and balance around the hips. And again, important we do them correctly. Feet and ankles. Now, ankle mobility is very important as we get older. So you can even do little things like ankle circles and little stretches of the ankles and the calf area, as you see in that second stretch. But ankle mobility has a big impact on our overall mobility when we're moving our body. So you can practice even sitting in a chair, just circling your ankles, or just testing, experimenting with how your ankles move, not just in circles, but left to right, forward and back. That ankle joint has got lots of different planes of movement, which just basically means lots of different ways it can move, and very important for that functional strength. Now, home exercises. So these are some, we actually have some handouts for, which we can send people if they're interested. But you can probably follow along on this kind of one too, but you do want to make sure you're doing them properly. So walking sideways, you can do this on a bench top, as you can see in the description here. So making sure you've got a clutter-free space for any exercise you do. That's very important. Just we don't want to have any trip hazards or anything that might just make it more likely we could fall. Very important. So all you're doing in this situation is stepping left to right or right to left, taking steps for one side, then 4 to the other. and you can play around with how big those steps are. Another important aspect of all the exercises, but in this one in particular, is the head is up. So try not to look down at the feet, but looking straight ahead, so at eye line height. Again, that's very good for your posture and balance, just making sure that we're using correct technique and getting into good movement patterns. That's walking sideways. And then you've got heel raises. So again, this is good for ankle mobility. These are very simple exercises. And I've called this a kitchen exercise, which basically means you could just do it in the kitchen or any kind of practical space, maybe while you're waiting for something, just getting yourself supported either with a chair or bench top. So you're lifting up the heels, but the toes stay on the ground. And you want that weight mainly through the big toe and the second toe. But your toes are spread and you're lifting up onto the ball of the foot and the toes. So you can progress these slowly. Now, very important with all these exercises is don't do too many to start with. That what we talked before about slowly progressing how much you do. And we have had situations where people come and they start off and they do 50 to 100 in one go. So we definitely don't want to be doing anything like that. We're looking at more of kind of reps around about 6, and then you build towards 10 and 12, and then maybe a maximum of 15. But you can obviously do more than one set through. But again, start with less. So again, 6 would be a good start point, particularly if you've not been active. So called the kitchen exercises or kettle exercises. So you could be waiting for the kettle to boil. This one is a knee lift. So you use the support if you need it. And again, you can reduce that support over time and maybe have less hold, but still maybe a little. And you're just lifting your leg up towards hip height, and you repeat both sides. So as you get better at that, you can progress to slow marching on the spot, up to 10 seconds on each leg. Now, slower is when you're doing this kind of movement, it's actually harder than fast, because the fast you don't need to balance as much. So you can play around with how much you can do with an exercise like that. But these are really simple balance and strengthening exercises. And another key point I would make here, just looking at that leg, is just make sure that you don't lock the legs. There's a little bit of a bend here in the knee. Now that's just important so that we're supporting the joint. And again, those eyes are looking straight ahead, not down. Okay, now we call this one a dining room exercise. Really, it's basically because we're using a dining chair. Now, sit to stand is a very functional movement. Now, in your everyday life, you probably stand up and sit down multiple times. So what we want to start to think about is how much of our leg strength are we using when we stand? Are we using our arms perhaps more than we need to? Excuse me a second. Or do we find we can use the strength in our legs? Now, this is something that we can lose over time if we're not paying attention and being careful. So we want to make sure, if we can, we stand out of a chair by pressing our feet down and using those legs. Now, you can use arm support on the chair with arms if you need it, but if you can do it without it, keep practicing that, because it's going to be very good for functional leg strength, which just basically means being able to do things in everyday life. And that's very, very important for our quality of life, to maintain the strength in the legs, to move around, to feel we've got a good level of physical ability. So there's 4 basic exercises that we just shared there. Obviously there was the one before, but 4 you could do in the home. And we've got a little fridge magnet we can send people who want those exercises to follow. And they're also on the website, which we'll have links to at the end as well. As I said, you can email us if you have any questions about this or anything else as we go through the presentation. Okay, so staying healthy and staying safe, looking at the eyes. So just a very quick message on eyesight, making sure that you've had your eyes regularly checked by an optometrist and reporting any changes in your eyesight to your doctor. So again, this kind of thing can creep up on us where we might find our vision changes. The support we need from glasses might change. You also want to make sure you take extra care with bifocal glasses. So just making sure that's obviously if you're changing from one task to another, to just make sure that you don't lose your balance or just get a bit disorientated at all if the vision is slightly blurred for a short period of time as it changes focus. So it is recommended 2 pairs of glasses for reading and then for longer distance. Again, just getting checked out is important. And then lighting's another one. Both of these two other ones are about lighting. So just allowing your eyes to adjust when you go from a light to dark space. You can often find it takes a little bit of time to adjust to that. So being slow in our movement from one space to another when the light does change. And then also sunlight. So when you're out and about wearing sunglasses and hat, just to reduce that glare, it's going to reduce, again, chances we might fall or just lose balance in some way. So especially important if you have any eye conditions, glaucoma or cataracts or degeneration of the eyes, macular degeneration, then you just want to make sure you're up to date with the prescriptions of your glasses, and you're keeping on top of that. That's just a good message to have. And then footwear is an important one as well for health. If we're talking about physical activity, we want to wear footwear that supports us in this. So if we're wearing shoes, that they're going to be the most supportive, they're going to fit us well. We can often find as well our feet swell through the day. So if you are trying on new shoes, make sure that they've got a bit of give there. And getting your shoes properly fitted is important too. Now this example of the shoe here, a little image, it's probably not a particularly great shoe to wear in many ways as we get older, because the heel there is quite a high level, high ridge, and that is not always the most supportive as we get older. A slightly flatter shoe will often support us more. So we want to avoid inappropriate footwear. That's a reasonable looking shoe. That was just one point. But obviously if we think more about sort of loose slippers or those thongs or things that don't have as much support, or a really high heel, these are the kind of things we want to kind of avoid, to just make sure that we are supporting ourselves, especially if we're going to get ourselves physically active or maintain that physical activity level. So this is just an example of a safe shoe, a supportive shoe. So again, talking about that heel cup, the right length of the shoe, enough width in the shoe as well is important. Laces are important. And again, just making sure that the sole is thin enough, but it does have enough tread for support. So again, just getting yourself checked regularly if you need to. But being active is going to help with the muscles in the feet too, to strengthen them up as well. So again, that message keeps coming back to being physically active. But do visit a podiatrist if you have foot pain or problems, and just for a regular review if you feel that's important for you. Okay, a little bit on medication, not too much, but just again, medication can have an impact on just our levels of risk of having a fall, but also it can impact us on many other ways. But exercise can often counteract the effects. Gentle exercise can be very supportive. If you're on more than 4 medications, then the risk of things like falls do increase, and that's why it's even more important we're doing balancing and strengthening activities to counter that. So again, just being proactive is probably the most important message there. And keep getting reviews with your doctor, your GP about the medication you're on, so that you can manage it the most effective and safe way possible. So now we move on to looking at hazards around the home and in the yard. So we're looking at kind of a falls risk. It's an important thing to think about, the space that we live in. A lot of falls can actually happen in the home themselves, and then obviously around the home. So we're looking at different areas of the house and the risk we have of things happening. So you can see a few of the percentage of risk there. So again, we want to think about things to make the space that we're in just that bit safer. So we want to make sure that we have things such as our floors, so they're not hazardous through being wet, slippery. We clean up spills as soon as they occur. We also want to make sure in the kitchen we've got a nice clear space, and we're just being aware of that. And then don't climb up on things to reach things. So sort of basic things, either asking for help or you've got a step ladder or something to climb up. But we just don't take risks with these kind of things. That's very important. And then the bathroom and shower area can be quite hazardous. So just being careful, again, on wet floors and having handrails if you feel they're important for you. Again, the same with the bath, shower chairs, those kind of can be very supportive. But we want to, again, think more about being active to make sure we feel physically capable, but it's having that awareness of a safe space. That's very important. Clutter is a big one, as I just briefly mentioned there. So just keeping the rooms and hallways clear of clutter. So kind of frayed edge carpets or mats, and then just removing cords, cables from walkways. Just even giving a bit of a scan in your home and think, what sort of things might I catch myself on other than the dog or cat? So again, lighting as well is also important. So make sure you have adequate lighting, and night lights can be very important. Often people fall in the middle of the night when they got up to go to the bathroom. So it's something to think about too. Yeah, you can, of course, also look at the outside. So handrails, often if you don't have steps and stairs with rails, that can be a hazard, or narrow steps as well. Again, just making sure, common sense, a lot of things, but putting things away, not having clutter, cleaning paths. And if you need to, or you feel you would benefit, you can get something assessed by aged care assessment team at your local hospital, or My Aged Care as well are quite good for just getting any assessment of what you might need. And then also hazards in public places. So won't spend too much time on this, but avoiding poorly lit places or going out when dark. Again, probably not something to avoid there. And then stairs and steps. So taking time on stairs, but also I'd say practice being on stairs. It's that use it or lose it. Again, keeping that back to that message of being active. So it's not to avoid doing any of these things, but just to make sure that we are supporting ourselves and we are aware of what things might cause us a risk or problem as we get older. Another key message is lifting your feet up. So a lot of the activities we've shown so far, those physical exercises, do involve lifting your feet. So you want to step by lifting your toes up, so you're not shuffling, which is more likely to cause a trip. And again, when you're out and about, again, just being alert and aware of what's going on with the people around you. And then we were on footpaths. A lot of footpaths now are broken or have damage on them. So again, you can report these things, but you just making sure that you are aware of that. We don't want to walk with our head down the whole time. It's important to keep ourselves tall, but we can be aware looking down from time to time and just lifting those feet as we mentioned. So just a few little messages around that, which is important to stay healthy and safe. Now, healthy eating. Eating is another one. Well, if we eat well, it's going to have a very beneficial effect along with the physical activity. We want to get ourselves to a healthy body weight. So we've got good bone and muscle mass. So we're looking more at our more muscle and less fat mass, which is just going to make us more functional, more fit for doing daily activity. Good mobility will come out of that as well. So eating the right foods will have the effect of that. Then we can do things, enjoy getting out and about, able to do the things that we enjoy, whether we mentioned before, playing with grandchildren or walking to the park, meeting with friends, or even being able to do things around the home. So kind of daily life activities as well. So the more we keep active, then things that are important, very simple functional tasks like washing our hair, reaching to cupboards and climbing stairs are things that we can manage. So that the eating well goes hand in hand with the physical activity. So the recommendation of 3 good meals a day, regular smaller meals and snacks, just to keep your energy levels up, and good servings of fish, not too much meat, poultry, so kind of chicken, and then kind of eating plenty of vegetables if we can. That's a really key message. Vegetables are very important for nutrition, the amount of value and nourishment they have. So eating vegetables is very important. And as we get older, strong bones. So we want to have enough calcium in the diet. So just making sure we have 1,200 milligrams, it says. You don't need to worry about counting milligrams or anything, but just looking to get around about 3 to 5 serves, whether that's through dairy, but also you can get it through some other sources, such as some nuts and also some green leafy vegetables, and broccoli there as well. So making sure we're getting enough calcium in our diet is very important for the strength of our bones. And to help absorb that, we need vitamin D as well. So vitamin D can be found in oily fish and liver, egg yolk and cheese. But you may also want to consider a vitamin D supplement. So it's something you could ask your doctor about. And then another point, obviously, with the calcium is around the osteoporosis. And that's one of the key reasons that we want to make sure we've got enough calcium to keep those bones strong. So get that checked out is a good thing when you're next at the doctor, if that's not something you've had done. So that's the kind of messages there. And then the other key one is around drinking enough water. So really important we have enough water, because a huge range of benefits being hydrated, so having enough fluid in our system. We can often feel sluggish if we don't have enough to drink, or over time actually we may even have got used to having less and aren't aware of how much of a difference it makes. So having those 6 to 8 glasses is a rough guide a day. Everyone will be slightly different, and obviously warmer days would mean we'd need more. So just keep that in mind, but sure to have enough through the day, even if that means a little reminder to yourself in some form, a little note, or if you've got on your phone a little calendar reminder there, so a little alarm, just to make sure you've had enough water. So a good little tip. So strong bones, as we talked about, the calcium-rich food and vitamin D. So eating overall balanced diet is very important for that good health, as well as maintaining strong bones and muscles. So overall, the message there is around being active and strong, being healthy and well through the lifestyle choices that you make. So you have the biggest influence yourself, what you can do. Doctors and other medical professionals are there for support, but there's many choices you can make as well in conjunction with them. Many simple changes in how much activity you do and eating well, and just reducing those other risk factors as we get older that can have an impact on our health and well-being. Now, if you wanted extra support, you've also got something called Get Healthy, which is a health coaching service. So it's a free telephone coaching service. Now, the number's on the form there. It's a 1300-806-258. Now, they offer basically 10 sessions over 6 months, and they're qualified coaches who can give advice around your diet and physical activity, and maintaining a healthy weight, as well as things like reducing alcohol or stopping smoking. On any questions you have, you can see they can help you there. There's also an Aboriginal program as well, but it's highly recommended, that telephone service. If you want to know more information, you can just phone them for an informal discussion. We also have some resources that can help you stay on your feet. So we talked about that exercise at the start. There's the fridge magnet on the left showing you some of those exercises. And then there's a Staying Active and On Your Feet booklet. So if you look at the website there, activeandhealthy.nsw.gov.au, that website will tell you all about, will give you the brochure, and actually where you can order the Staying Active and On Your Feet brochure. If you want to get this one, you can send myself an email at the end of this presentation, and we can post that out to you. But you can also find it online on our website too. But again, just email us for any more information on that. If you're interested in doing more, obviously at the moment, it's not quite so easy to do more, just because obviously the restrictions in the programs we don't have running at the moment, and probably won't for the rest of the year. But we are looking at doing some online programs. So please get in touch, even if you just want to get on a waiting list for when some programs start. So what we offer at the moment is we do a general program for over 60s, so really for anyone who's inactive. And then we also do a specific program called Stepping On, which is for people who are at risk of a fall or who've maybe had a fall. So a bit more information about these programs. So the Healthy and Active for Life one, this is the general over 60 program. And then this would be face-to-face, but we are looking soon to do an online one. So if it's not possible, which it won't be at the moment for us to deliver face-to-face, unlikely for the rest of the year. So hopefully by start of 2021 we can resume, but we will have to see how the space goes. But basically the program design is it's 2 hour face-to-face, so 1 hour of exercises, and then it's a tea and coffee break, refreshment break, and then a discussion time around well-being, different topics. So that's Healthy and Active. And then Stepping On, again, as we mentioned, for those who are at risk of having had a fall, is an educational well-being program. So 12 to 20 participants in each group, similar as the other one. There's a lot of screening and assessment done to see how you go and how you progress. Some very basic but effective exercises. And again, the content is similar, covers a lot of topics, which we've covered a little bit today, but go into a lot more depth in around things you can do to reduce your risk of a fall, to stay healthy and improve that mobility and independence for people. So that just gives you a bit of an overview of the programs that we run. When we do this presentation in person, we would run through some of the exercises as well that we've shown you or on the earlier slides. So hopefully in the future we'll be able to do that again, resume some face-to-face sessions. But we are definitely wishing and very keen to support people who'd like to get more information on anything we've talked about today in this presentation. And then you'll see on this last slide as well, you can take a note of that. We'll leave this slide as the last one up, but there's the email address for getting in touch with myself, or my phone number if you'd like to call instead. Or also, at the moment with our situation with COVID-19, we do have a website as well, which gives information around ways to stay healthy as you get older, as well as more general information, which is constantly updated. So you know you've got a reliable source for information in Western Sydney. So I hope you found this information useful. Please do get in touch if you have any questions or you'd like to go on a waiting list for any of the programs. We are also looking at trying to offer some phone support for people who are in need of that at the moment, who feel they would like that support in terms of information about health and well-being. So yeah, do get in touch through the contact details on this page, and yeah, we'll hopefully hear from some of you soon. Stay safe, stay well, keep looking after yourself, keep being active, or start to do some activity if you haven't, and make those healthy choices with the food you eat as well. Thank you very much for your time. Bye for now.